পাঁচের সাথে তিনকে।
Hello friends, today in our live session I am going to discuss about hydrocephalus, and if there is a time in hands I shall discuss about epilepsy. First I shall discuss about hydrocephalus in the light of homeopathy. So let's start. Hydrocephalus is a medical condition in which excess cerebrospinal fluid accumulates in the ventricles of the brain, causing increased pressure on brain tissue. So, diagnostically, remedies for hydrocephalus are those which can absorb the effusion in the head. Moreover, in some cases, cranial bones, the bones of the head, those bones are called cranial bones. You know the cranial bones, how many cranial bones are there? There are 8 cranial bones: frontal, parietal, temporal, occipital. You know those names of the cranial bones. So, the cranial bones remaining soft, the skull gets enlarged due to pressure inside. So, the chief remedies in this case are different in homeopathic approach. So, the causes of the hydrocephalus need to be discussed. What are the causes? First, the congenital, that means from birth. Next, brain infection, meningitis, maybe meningitis, encephalitis. These are infectious diseases may cause hydrocephalus. Then brain tumor, head injury, brain blockage in CSF pathways, cerebrospinal fluid pathways. So these are the main causes of hydrocephalus. How many types are there? How many types of hydrocephalus are there? Uh, Number one, communicating hydrocephalus, that means synovial uh, uh, cerebrospinal fluid flow blocked after leaving ventricles. Non-communicating obstructive blockage inside ventricles. Normal pressure hydrocephalus, NPIs, mostly in the adult elderly cases. Congenital hydrocephalus. So these 4 types of hydrocephalus are seen. There are so many symptoms for hydrocephalus. What are those symptoms are? Especially for the infants, for the children, you may see the head is enlarged of the baby, bulging soft spot at the front of the uh, head. There is a soft spot bulging, vomiting, seizures, downward looking eyes, sunset sign. In the both for the children and the adults, these symptoms are very often. Number one, there will be a acute headache, nausea and vomiting, vision problem, balance difficulty, memory problem, confusion. These are the main uh, problems may be seen both for the children, both in the children and adults. Hydrocephalus is a serious neurological condition. The only proven effects treatments are ventriculoperitoneal BP, what is called BP, endoscopic third ventriculostomy ETV, and treating underlying cause, tumor, infection, bleed, etc. Delay in proper treatment can cause permanent brain damage or death from hydrocephalus. So now, homeopathic medicine to check the reality. It is very important. Some homeopaths suggest medicine like Calcarea carp, Apocyinum cannabinum, Helleborus, digitalis, netramur are very important. Moreover, in some cases, cranial bones remaining soft and skull gets enlarged due to pressure inside. So the cheap remedies in this case, according to Mr. Bhattacharya, Dr. Bhattacharya, Lycopodium, apis male, sulfur, calcarea carp, calcarea phos, etc., apart from other remedies which may be considered symptomatically. Silesia also has the power of absorbing fluid content increased due to periodical moon's effect on body. As has been discussed earlier, sulfur, lycopodium and epismel have great power of absorbing fluid in the body. So, but caution should be taken in selecting potencies. The wrong potencies can aggravate the situation to worse. The softness of cranial bones, fontanellis, require calcarea phos to be taken for some times. Lycopodium is applicable when it is due to malfunctioning of liver, even for excessive loose stool. Helleborus may also be a very good remedy. Now let's discuss about some homeopathic medicine with their specific symptoms. The first comes calcarea carp. Calcarea carp may be considered for the hydrocephalus case when having large head with delayed closure of frontanel, sweating on head especially during sleep, cold, damp hands and feet, slow development, delayed milestones, flabby body, poor muscle tone, child tires easily. If such symptoms are found, calcarea carp may be selected. Number 2, Apocyinum cannabinum. Apocyinum cannabinum may be considered when fluid accumulation in brain and body. If there is a accumulation of fluid both in brain and in body, puffy face, eyelids swollen, scanty urine, great thirst or no thirst, head feels full and heavy. In that cases, Apocyinum cannabinum is a good choice of medicine. Then comes Helleborus niger, mental dullness, stupor. Child does not respond, surrounding, automatic head movements, rolling side to side, sudden shrill crying, cold body with warm head. Often quoted an advanced brain involvement. Digitalis also may be considered when very slow pulse, bluish lips or face, extreme weakness, cold sweat, head symptoms with heart weakness. If there is this type of symptoms found for the hydrocephalus patient, digitalis may be selected. Then comes natramure, chronic headache, sensitivity to light, emotional withdrawals, craving for salt, worse in heat, then natramure may be selected. Sixth, silesia. When we should select silesia, delayed closure of frontanel, weak bones, poor immunity, slow growth, cold intolerance. In case of these symptoms, silesia may be given. So, this is about all about silesia, hydrocephalus. Let's talk about epilepsy. Epilepsy is a neurological disorder in which a person experiences recurrent seizures due to abnormal electrical activity in the brain. It is not contagious disease and can affect people of any age. The causes of epilepsy include genetic factors, brain injury, brain infections, high fever during childhood. This type of issues, epileptic issues, may arise due to tumors, strokes, or complications at the birth time, may also be a reason for epilepsy. But there is also instances, for the many cases, the exact cause cannot be identified for the epilepsy. The common symptom of epilepsy are sudden loss of consciousness, jerking movement of the arms and legs, rolling of the eyes, frothing at the mouth, and temporary confusion or memory loss. After a seizure, the patient often feels weak, tired, or sleepy. Epilepsy is a main epilepsy is mainly treated with an anti-epileptic drugs in um, allopathic modern medicines, that is called AEDs, which help control seizures in most patients if taken regularly. In some cases, surgery or special therapies may be recommended. It is a disease of nervous system actually. For the various reasons, epilepsy may occur, but all convulsions are not epilepsy. You need to understand what is convulsion and what is epilepsy. Convulsion means খি- খিচুনি খিচুনি তো সব খিচুনি হলেই যে সেটা এপিলেপসি হবে তার কোনো মানে নেই. The causation and all kinds of epileptic features are not discussed here because it is not the objective of the book. It is not the objective of us. Symptomatically, there are several remedies for epilepsy and several opinions also for their applications. But it is better to take a look to what does actually happens when epilepsy occurs. If it is possible to analyze the epileptic phenomena, we may find out remedies of it. Diagnostically, diagnostically, now we all know for some reasons a sudden abnormal impulse of nerve creates epileptic seizures on the body. But modern advanced researches in the elite universities of the world, published in the renowned science papers, reveal more about epilepsy and the chemical changes and the realistic in the brain during its occurrences. It is obvious that due to sudden and rapid excitation of the nerves and its inhibition, the normal flow of the system gets disrupted, and then abnormally vast number of changes flowing in the system make the function of the body abnormal or uncontrolled. There are two types of neurons in the brain: excitatory neurons, inhibitory neurons. The neurotransmitter glutamate is released from the excitatory neurons, while gamma amino butyric acid is released from the inhibitory interneurons as well. Control to coordinate between them keeps the flow of the position positive and negative ion normal. There are several remedies which are used and also given importance in the treatment of epilepsy, but these remedies, such as netramure, calcarea, butyric acid, are of seldom use. It is observed that remedies generally prescribed for epilepsy may have some symptoms of these diseases, but there are several other diseases also which nerves are affected and almost same set of symptoms are seen. In that case, temporarily few symptoms may seem to be removed, but the originally disease may not be cured or rather may get aggravated. Calcarea carp is one of the cores of source from which positive calcium ions emerge, but calcarea chloratum must be more significant in that sense. The potencies of the remedies in this case will be different according to the required action over controlling the ions of opposite charges emerging from brain. To resist the emergencies of the excess positive ions of sodium, calcium in brain, higher potency of natramure or calcarea mure is required, which to put more negative ions in the system. The lower potency of the butyric acid is required. An explanation regarding the potency is given in the latter part. There are several remedies mentioned in the Materia Medica for epilepsy, which may be used symptomatically in epilepsy, but not at all the time they are found to be suitable for the diagnostic point of view, such as cicuta virosa, which is not seem to be a remedy for epilepsy, even in violent convulsive nature. Diagnostically, it may be a remedy of cysticercosis and tetanus. Its own affections and involvement in cerebrospinal meningitis includes indicates the disease cicuta virosa is meant for. The poisonous buffo species of toad were used by the village women of South America to reduce their husband's urge, but eventually the suppressed uh, urge was converted to epilepsy. Thus, buforana is indicated as the remedy of epilepsy and due to sexual derangements. Few more applications, medical applications. Epileptiform jacks in newborns, Silesia 200. During menstruation, if epileptic symptoms are seen, convulsions are seen, then netramure 200 and simicifluvaga 200 are good medicine. During sleep, buforana 200. after the trauma of convulsive seizure, spasmodic contraction, cupramate 6 or cupram acetate 30 is the best medicine. Myoclonic twitching, Nux vomica 200. To minimize the damages of convulsion, Arnica montana 3 are the useful. So, we have discussed hydrocephalus and epilepsy. So, it's the time to say goodbye. See you in the next live session, and till then, thank you very much and good night.